is for this reason that we are still appealing first that those living in areas frequented by long distance truck or the parking for those trucks, and their intensity of interaction is more noticed in Maimayu, Kikope, Barnabas and Salga. Kindly be cautious on how you are interacting with the strangers in those areas. We are not saying that they are sick, but we also don't know, because nobody can be able to see this virus by eyes and say that this person has just been infected. We already have 4 people, actually not 4, 5 people, who attended a burial and went to an extent of dressing the dead, and yet the dead was a victim of COVID-19. The 5 of them are at Kitina as we speak, in a mandatory quarantine. With the same breath, some 6 were found locked in a bar and enjoying their drink. And of course, there are those who are serving them. We have also taken those to a mandatory quarantine at Kitty, and they will be there for 14 days and they will pay the bill for themselves. We had even realized that one of them had a history that his cash bill at the police station had accumulated 20,000, and yet not willing to change. We will not relent and we will continue quarantining them at their own cost. We have formed a multi-agency team to deal with the various matters of complaints that are being raised by members of the public in regard to violation. And for clarification, those who are already in forced quarantine for having been locked up in a bar, first of all, being locked in is a violation in itself, which means the owner of that bar must lose the license. Secondly, after completion of the quarantine period, whether they are positive or not positive, because they will have to be subjected to test, they will also face a legal action for violation of directives. And on top, it is them to meet the cost of that quarantine.
So far, we have had 45 persons with suspected symptoms screened in our facility. And out of these 45, some of them were volunteer persons who came. Some were actually reported by members of the public. And out of these 45, as you may be aware, 2 weeks ago, we had 2 who turned positive. And after they turned positive, we treated them in our isolation center. And after the 2-week period, we tested them the first time. They were negative. And yesterday, we also tested them for the second time. And they also tested negative. As we release them to go back to the communities where they came from, we are also tackling the bigger problem of stigma. They would otherwise have been here to probably give a statement or so, but as we all know, there is a rising problem of stigma, that persons who have been confirmed to have this disease, when you finally return them to their community, the discrimination and stigma from the very same community that should be supporting them has not been very good. So we would want to take this opportunity to request the immediate members of the family, the communities where these 2 patients come from, to help us in the reintegration of those 2 patients so that they can continue with their normal lives. We have also sent a team to do counseling to the immediate family and the community around there, but we have seen stigma and discrimination as a key problem. Working through our health care workers, we have had a total of 191 suspects who have been quarantined, and these were as a result of contact tracing. When you get one patient, you want to see where they have gone, And out of these 191 that we have quarantined, we have gotten results for a total of 186, and they have all been negative. We have 5 pending results, and we expect those results by tomorrow. We are also planning to undertake mass testing for frontline healthcare workers who are exposed to the virus. We acknowledge their sacrifices and will ensure that regular testing is conducted as a prevention strategy. A special treatment center has been dedicated at our PGH annex, and it will have 4 ICU beds and a team specifically to deal with our healthcare workers. So should there be any instances when our healthcare workers have been confirmed or even suspected for purposes of quarantine, we have a special unit that will be dealing with this. But we are happy for now, we have no case of that kind. We have also noted with great concern about the exposure of communities living in areas frequented by long-distance truck drivers. These areas, as we have noted before, include Salga, Maimahiu, Kikope, Longonot, and Barnabas. These truck drivers move from Mombasa, they come through Nairobi, they go all the way past our borders to Kampala and even up to Kigali. And as we all know, some of those places where they are going across have already been closed because of the high cases. So as a result of that, we consider these particular centers areas of high risk. And consequently, we have started screening the truck drivers as they pass through these places. And so far, we have screened a total of 2,119 drivers, out of which 3 have demonstrated symptoms consistent with COVID-19, and since then have been put on quarantine and treatment and observation for that matter. We therefore want to take this opportunity to urge the community living in these areas to be extra vigilant in managing these visitors who come from areas that have previously had high cases of infection.